Hi, I'm Phil Moeller. I write articles and books about retirement and healthcare issues, and I've written a lot of pieces about Medicare. Among the questions I get asked, one of the most frequent questions is, what do I do when I'm approaching 65? I plan to continue to work, but I work for a small employer. There is an initial enrollment period that's pretty long. It can be 7 months if you're turning 65 and you have to get Medicare. You don't want to wait 7 months. You don't want to have a break in coverage. So I urge people to assume that this is a decision they need to make on a pretty timely basis. In most cases, when a person is about to turn 65 and they work for what I'll call a small employer with fewer than 20 people, they have to get Medicare. When that happens, their employer plan moves from being primary insurance provider to secondary insurance provider. What does that mean? It means Medicare becomes the primary insurance provider. However, as you may know, Medicare doesn't cover everything, and so having that secondary employer coverage can be very important to you. How important? Well, it depends on your employer plan, and one of the pieces of work you need to do before you turn 65 is make sure you understand how your employer coverage will work once it's no longer primary but secondary coverage. Some employer plans provide great secondary coverage, some not so great. You need to figure out which one applies to you. In particular, a lot of so-called retiree plans will continue to provide pretty good secondary coverage for things that Medicare doesn't fully pay for. They may also provide pretty good drug coverage. And this is an important consideration because Medicare can cover all of those things as well. You need to understand what's going to be covered, what's not going to be covered. Once you know that, then you can approach the Medicare decision, because getting Medicare, of course, doesn't just mean one thing. It could be, for example, that your employer plan does a really good job of picking up things that Medicare doesn't pay for. If that's the case, probably getting just Medicare A and B is okay for you. If your employer plan does not cover drugs, then you're going to want a Part D plan as well. Your job is to make sure you understand how your employer plan works. If you do get drug coverage through your employer, it has to be credible, meaning it has to be at least as good as a typical Part D plan. If so, you're fine. If not, even though your company may offer secondary drug coverage, you probably still need to get a Part D plan. While you can get Parts A and B, you can get them in more than one way. So you could get traditional Medicare, which is A and B, maybe a Part D plan, but you could also get a Medicare Advantage plan. In that case, you get A and B, usually with a Part D drug plan folded in, and you also get some supplemental coverages that aren't available with original Medicare. You can get gym memberships, you can get hearing, vision, dental coverage. These are all things you should pay attention to, and most of all, you need to pay attention to what your health profile is and what your care needs are likely to be, and you also need to pay attention to what your out-of-pocket costs are going to be. For example, there could be some plans that look terrific on paper with low premiums, but end up being very expensive if you use them. So how much health care are you going to use, and what's the best insurance plan to provide you the health care you need? You also need to pay attention to your family. In most cases, your spouse or your children, if they're covered on your employer plan, will continue to be covered on your plan even though you get Medicare. But you need to find this out and make sure that there are not any unpleasant surprises for you. This is especially the case if you decide you may want to just drop your employer plan. It could be, in some cases, just Medicare itself is fine. That's going to depend on the kind of coverage your employer plan provides and also on how much you pay in that premium. Does the premium drop when the plan moves from primary to secondary? These are things you got to pay attention to. And again, if you were to drop that plan, how would you insure your spouse and your kids? Those are very important considerations. Now, normally, I always tell people, well, talk to your employee benefits person. But when you think about that for a company that only has 20 employees, the odds of having an employee benefits person are probably not great. In this case, I think you're going to end up practically, you're going to talk to your health insurer. So I know we've covered a lot of ground today. I want to make sure you pay attention to what is your secondary coverage like? What kind of Medicare plans do you want? How are you dealing with your Part D drug plan? And is your family taken care of? Which you always want to make sure you do. I hope this has been helpful to you. If you have any more questions, feel free to go to MedicareMadeClear.com. I'm Phil Moeller, and it's been a pleasure spending some time with you.